guys, welcome back to Keeping Up with China. Today we're back with another video. As you guys can see, I'm not in my room. I'm kind of just tired of just filming inside the room. Me and my little sister have like this little corner where we just record, and we're just like, well, I'm tired of it. So I've just been trying different places in the house, and this is the best I can do, guys. The lighting is kind of terrible, but we're just gonna, work with it. But today, we're back with another video. If you're new, please make sure to subscribe, and also make sure that you click on the notification bell, you guys. I'm so tired, guys. I just came from work. So tired, but it's okay. So this video is just going to be like a little quick life update, basically, you can say. Yeah, like what's been going on, what have I been doing, and stuff like that. Yeah, so let's jump right into it. Yeah, so as most of you guys know, that I graduated nursing school. Well, I passed my nursing board exam about 2 months ago. Let me see, June, July, August. A little bit over 2 months ago. And I've been working as a home health nurse. I'm gonna go a little bit more into detail on what is home health nursing for the people who do not know what it is. But beside that, I've just been working and trying to enjoy life, barely. And also, I've been applying to hospitals because I'm trying to get a hospital job also. So yeah, like I've been applying literally everywhere. Like I do about, like, I believe like 5 to 10 applications a week, I believe. So I'm hoping that, I've had like about 4 interviews so far, I believe. So I'm just keeping my fingers crossed. I hopefully get one position, well, a position that fits me best, soon, pretty soon. But yeah, I'm gonna talk a little bit about home health. Basically, what home health nursing is. I mean, specifically for me, I'm gonna talk about like what exactly I do as a home health nurse. So I mostly work with kids. I mean, the kids that I work with, they range from like 6 months to, like, the oldest one I've worked with so far was 23 years old, which was older than me. But they are disabled kids, so like so yeah, yeah. So that's the age range that I've been working with so far. Yes, I do like it. Like it's very, it's very rewarding, actually. So what is home health? Home health nursing is basically, what we do is like, we provide care for patients. Like, for example, I mean, I work with kids, so I'm gonna just speak about kids. But what we do is, like, we go to their homes because a lot of the time those kids have multiple problems and stuff like that. And you know so what we do as home health nurses is we go to their house. We take their vitals, like, their blood pressure, their temps, and all this, all these good things that comes along with taking vital signs. And then we give them their meds, and also their feedings. A lot of this, so far, all of the kids that I've worked with so far, they've have like G tubes, where like you have to, like, give them their meds and their feedings through their G tube. So that's another thing. And also, there's a lot of there's a lot of the patients that are also on vent, which is like a machine that that helps them breathe and stuff like that. It you know it gives them the the oxygen and ventilation that they need to to breathe. I don't know if I explained that well, you guys. I'm not really good at explaining these things, but I mean, you guys can get the idea of what I'm talking about. Yeah, so those are the patients that we mostly deal with, because those kids are most of them are disabled. So a lot of the time we have to clean them, bathe them, and just make sure that they're safe, and nothing's going on. And a lot of those kids are also on seizure precaution, so which means we have to make sure that they're always like there's always they're not in harm's way, and also just just monitor them to make sure that they do not have seizures and stuff like that. Yeah, like we just, but for the most part it's a pretty chill job, because it's you only have one patient for the for the most part. It should be just one patient, and so we just take care of this one patient for for the amount of time that you're supposed to be with them. Like the shifts ranges from 8, well, I wouldn't say 8, from 8 to 16 hours. The longest I've done was 16 hours, and the shortest I've done was actually 1 hour. But those 1 hour visits are just like quick, like to do their vitals, and give them their meds, and probably like help bathe them and stuff like that, and then that's it for the 1 hour visits. But for the most part, I've only done like I mean the shortest shift that I've done, which was 8 hours, I believe. I lied, you guys. 5 hours. 5 hours. Yes. So it ranges from 5 hours, 8 hours, 12 hours, 13, 14, 15, and 16 hours is the max, I believe, that a person can do. So now I'm just gonna be talking about the pros and the cons when it comes to home health nursing. The pros, I would say, first and foremost, like it's you only have one patient, so which mean like you, so all of your attention goes to that one patient, so you don't have to worry about getting new admissions, or so you know this patient, and you'll know that you're gonna be with them for the whole shift. And you're pretty you build rapport with that patient, so you know what's going on with them and stuff like that. So that's a plus. Another pro is that you get to with home health the nursing, you actually get to pick out your schedule. Like for me, I pick out what days I want to work, or and they ask me like what days I want to work, or which shifts that I want to pick up and stuff like that. That's pretty nice. And another thing is if I don't want to go to work, I just say I don't want to go to work. I just call them and be like, hey, I'm gonna be I can't go to work, blah 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 blah, this day or that day, and they'll just find someone to cover that shift, which is great, because so I mean, if you don't feel like going to work, just call them, and then they'll have like a replacement and stuff like that. Sorry, yeah, something in my mouth. Another pro, I would say, is I actually honestly cannot think of any other yeah, I mean, the most thing, I mean, the most important pro that I can think of is having just one patient and just, focus on that one patient. The families for the most part are very nice. So, like, they're pretty chill and lenient and stuff like that. So, so it's pretty chill, actually. I like it. The cons, I would say, a lot of those agencies, because when you work as a home health, for most of the parts you're going to be working with for a company, which is an agency. So yeah, like most of the time they don't offer a lot of benefits like you would if you were to be working in a hospital. For example, they a lot of them do not offer like a 401k, um insurance if you need insurance and stuff like that. Okay, I'm not saying that all of them don't, but I mean, so far the ones I've been working with, they do not offer those those benefits and stuff like that. Another thing, well, another con is that there's no PTOs. Like pay time off. We don't get that because we're not really in a contract. We're just working. I mean, it's like if you want to work, you work. If you don't, then you don't. So that's that. Yeah, and there's another thing is that if you work overtime, you don't get paid overtime. Like you just if you want to do more hours and stuff like that, you can, but you're not gonna get paid extra for that. And another thing is I work with like about two companies right now. For example, if I don't have any cases in this one, then I can try to find another case in the other one, which helps a lot, because sometimes there's not many cases and stuff, especially if they're not like permanent cases. Like yeah, so it's nice to work with a few of them. So like you can always have something to work with, to work for. So yeah, yeah, and then my last con, there was more cons than pro. I don't know why. I don't know why, but and another big well, it's not big, but another con would be the pay. The pay is not as much as it would be if you are working in a hospital. I mean, it's not so bad to the point where you'll be like, oh no, I'm not gonna work for this. But then again, it's not as as high than we're working in a hospital. I mean, it makes sense because you're only with one patient. You're not really underneath all that pressure and stuff like that. So you'll have more free time to kind of chill and stuff like that when you are doing home health and stuff like that. And working in a hospital setting comes with a lot of more responsibilities and a lot more. So I mean, I understand why. I mean, they would pay us less than if you were to be working in like in a hospital setting, or like a retirement home, or like something of that nature. But besides that, I mean, I like it so far. Like it's not where I want to be, but I mean, this for the meantime, I am enjoying it. It's nice to be working with the kids and stuff like that, and the families are like very nice and stuff like that. So I really enjoy it. But I mean, I'm still looking for a hospital job. I'm not really sure. Right now, I'm just leaving it into God's hands, because I mean, the positions that I've been applying for, it's not really the position that I want to work with, for sure, because I know that I want to work with kids or babies. But I mean, if I have to do like a med-surg position for a year or so, maybe I might. I'm not really sure, but I'm just applying everywhere, and I'm just trying to I'm just hoping that I make the right decision when the time comes. So, but other than that, I've just been chilling, just in trying to enjoy my little no study, because I've been studying for the longest for nursing school, so I've just been enjoying that, having fun and sleeping in and just working. Yeah, I work so much. I work a lot. Like, I think I work too much. Like, some weeks I will work like 40-50 hours. It's ridiculous, but I mean, gotta make that money out. But other than that, it's been good. Yeah, so if you guys have any questions regarding home health nursing and stuff like that, you guys can put it down below and I will respond. Thank you so much, guys, for watching. I will see you guys on my next video. Thank you. Bye.